want to welcome you all to the Wellbeing at Work podcast series. My name is Andre Ajeev, and I have the pleasure of welcoming back Dr. Brian Palmer, Medical Director at Health Partners. Dr. Palmer received his medical degree from Mayo Clinic Alex School of Medicine and completed his psychiatric residency at Massachusetts General Hospital and McLean Hospital. He has been in practice for more than 15 years. Dr. Palmer, welcome back, and thank you again for joining us.
It's so good to be back, and I'm glad we can talk about this important topic.
Thank you. Before we dive into today's conversation around the pathways of providing support and resilience for employees after cancer, I want to share some statistics. According to the World Cancer Research Fund, the U.S. and Canada have some of the highest age-standardized rates of cancer in the world. And according to the American Cancer Society, we're projecting over 2 million cases of cancer in 2025. It has also been noted that breast cancer is the most common form of cancer amongst women in the United States. These statistics are in no doubt startling. Cancer touches almost everyone in some capacity, whether that is a friend, a family member, or a coworker. And it brings a myriad of emotional challenges that extend beyond the physical aspects of the disease. The emotional toll of cancer on both the patient and their loved ones is often far-reaching and devastating. I am no stranger to that myself, and I'd like to also share a personal story about cancer. My story, unfortunately, does not have a happy ending. In late 2016, my partner's father was diagnosed with stage 4 pancreatic cancer. At the time, she was traveling full-time for work, and she recalls how scarce workplace resources were, not only for her father, but also for her. The only support she remembers from that time is from her direct manager telling her, "Let me know if you need anything." And the reason I bring this up is that employers and managers often tell me wholeheartedly that they believe their employees would turn to them should they be facing such a challenge. But according to the Working with Cancer Pledge, 50% of cancer patients are afraid to tell their employer about that diagnosis for fear of job loss, being reprimanded, being seen differently. After 2 years of battling the disease, my partner's father unfortunately lost the battle. And with the rising cancer rates in the world, I believe it's now more imperative than ever that we have these conversations and employers create a psychologically safe environment to help those diagnosed with cancer and the people around them.
What a powerful story you're sharing. It captures so much of what we're going to explore today, Andre. The experience of loss, the fear, the sense that one's experience isn't recognized and can't be brought forward, the sort of darkness around it, all in the middle of a grieving process and personally toiling time. I really appreciate your sharing it, and I just want to acknowledge that it's a lot to go through for certainly your partner's father, but everyone around him as well.
Thank you, Dr. Palmer. As you said, it is a powerful story, and I'm glad I'm able to share it with you. And let me ask you, in your professional experience and your expertise, what challenges are presented with the diagnosis of the disease?
Yeah, I think we could answer that question in terms of maybe 4 areas: the individual themselves, the family, coworkers, and the organization that they're in. We're bringing a workplace lens to this conversation. For the individual themselves, there's a lot involved. The physical experience, when I think of your story, the pain, the fatigue, the treatment side effects, the cognitive side effects of the treatments, chemo brain. We think of the emotional experience. I think most people have some degree of fear. They're confronting what could be a condition that impacts their mortality. They're confronting social relationships and how those may change, and they're faced often with a lack of knowledge. The healthcare system is frequently confusing and overwhelming, and there's the people who are in the healthcare system and do it all day, every day, are very familiar with all of it. But for someone with a new diagnosis, this is often their first entry into a process that could involve, advanced treatments and hospitals and doctor visits. So the individual themselves has certainly an experience of that. Then there's the family, and the emotional strain of the family, the stress, anxiety, feeling burned out at some point, and then feeling guilty for feeling burned out, time commitments that are involved. Often there's a financial strain, and families also can have this lack of knowledge. Moving from there into the workplace, I think coworkers are often challenged as well. They have their own emotional reactions, certainly concern for their colleague or peer, disbelief, fear, anxiety, and some awkwardness. Do I ask questions? Do I not ask questions? Am I supposed to ignore this and we just talk about work? What feels right there? There certainly can be some increased workload, and some coworkers can feel resentful. I think in my own practice, I had a colleague that has just finished 7 years of her journey with breast cancer, and she, unlike your example, is coming out the other side feeling well. We just had dinner recently, and she told me she feels well for the first time in 7 years. But she was surprised she was unable to take call in the hospital because of her recovery. It's entirely understandable. But that meant her colleagues had to do more work. And there was some subtle and not so subtle resentment that those call shifts had to be picked up. Then I think finally the organization, more broadly, there are legal obligations for the organization. There's concerns about productivity. There's concerns about the morale, and there are financial implications to the organization.
Thank you so much, Dr. Palmer. And I do have to say, I'm very happy to hear that your colleague is doing well. That is great news. And wow, there truly are a lot of different aspects, a lot of people impacted whenever there is someone around us that is diagnosed with this disease. Now, you did talk about the organization, the coworkers, and I wanted to ask a little bit more about that. What role do you believe workplaces play in supporting employees navigating the challenges of cancer from that initial diagnosis through to the transition and back to work after being diagnosed?
Yeah. Well, let's break that down. I think during an initial diagnosis and treatment, there's several aspects. First, and I'm glad we've already gone into this, and I hope we continue to emphasize it, just the human emotional support. The workplace can really be a source of considerable support. People pull together, people support one another, people offer empathy. And I think that's as important as anything else, is just meeting people where they're at on a human level. I think there are some practical things, thinking about flexible work arrangements where those are possible, thinking about options for paid or unpaid leave, thinking about how the coworkers should be communicated with and what privacy issues need to be respected. And I think the person themselves, the person with cancer, should have some degree of autonomy in determining what those preferences should be. And then I think certainly making sure that people have access to their health benefits, coordinating with resources such as the Employee Assistance Program, health plan, case management can also really be key. So if we've established up front that there's an empathic environment that's going to address both the emotional and the practical needs, then I think that positions us to think about the second phase of your question, which is in recovery and moving forward from there. We need to think about gradual return to work plans, modified or temporary duties, what adjustments need to be made in the workplace, how we can bring in the EAP and build some longer-term flexibility, because it's not so simple. I mentioned my colleague that had finished a 7-year journey, and it actually does feel finished at this point. She certainly has a risk of recurrence, but it has been a journey. But in that, there were periods of, I need to go back for more treatment. I need to reduce my hours. I'm needing to go through another round of chemo or radiation. I'm having a surgical intervention. It's not just a linear process. It's building a culture where the health needs of the employee and the emotional needs of the employee can be met, and that can evolve and change over time. And then finally, I think adding in some emphasis on financial and career support can be important as well. I think most people are surprised how the financial aspects of treatment or reducing hours or time away from work really weighs on people. And then there's a perception that their career is now going to be sacrificed or harmed in the process if they're taking time away, especially for people who are on an upward career trajectory. They have worries about that. So how we can support people's continuous career growth, knowing how important work is for people's professional identities and personal identities.
Thank you for that, Dr. Palmer. What's resonating with me is solely how much different types of support is required for this. We talked about creating a culture and having that human emotional support, discussing work arrangements, having the privacy, the flexibility, the right communication. This must truly be hard for employers and for managers. And in your experience, what would you say would be truly the key skills that you would recommend a manager or even peers to build to effectively support someone that's going through cancer?
Yeah, I think you're right. It's sort of, we're asking people to become superhuman at this. They need to be, on the one hand, the most empathic counselor, and on the other hand, they need to be sophisticated in their navigation of resources and options, and they need to anticipate needs, and those needs may change, so they need to anticipate them better. It is a lot to ask of our leaders and our managers to be able to meet people where they're at. But if we just break it down, I think first, this issue of empathy. Just start with empathy, understand where someone is, and where someone is may change, but understanding today where they're at with just some active listening, opening up space to think and feel, allowing people to share where they're at and ask for what they need. I think in your partner's case, don't you wish someone could have just sat down with her and said, what do you need? Don't say, come to me if you need something. Assume there's a need there. I mean, that's the empathic stance. You would assume that there's a need there. Her father was in the throes of pancreatic cancer. Of course she has needs. So let's start with assuming that there are needs and then empathically understand it. Second, I think this issue of confidentiality becomes important, and respect for privacy. Some people are very comfortable sharing their health details, and some people are not. And it is a workplace. We want to have appropriate boundaries, and that's important. So discretion, sensitivity, and asking directly what people are comfortable sharing and what people would like coworkers to know and what people would not like coworkers to know. I think third, it's always true in a workplace that effective communication is important. So clear, honest communication. And I would add to that some regular check-ins. I've mentioned a few times the person's relationship to their diagnosis, their physical state, their understanding of what they need in the workplace, that changes. And so checking in regularly, assuming that there will be changes, assuming that there will be needs, becomes really important in the communication process. Fourth, I think the workplace focus on sensitivity and inclusivity, and we talked about this a good deal in our last conversation, is so key here. When you're able to build a workplace culture that sees people for who they are as an individual, that comes at this through a lens of inclusivity and building a culture where everyone can belong, that helps. That helps build this ability for people to have their needs met effectively. Two more that come to mind. I think problem solving is a skill that is needed here, and oftentimes that's going to have to be creative problem solving. When we think about how to navigate accommodations, sometimes it's physical accommodations. If someone is having lymphedema and their arm is swollen and they can't manage to sit at a desk easily, that's going to need one set of accommodations. The other is the taxing toll of a work day that some people may need breaks, may need to have different hours, certainly may need to reduce their workload or change their tasks. And there's just going to have to be some creativity, and it may not be the same every day. And allowing for space where that can be the case is important. And then I think finally, there is some conflict that can show up in workplaces around this, and being able to navigate that. There's stigma. There can be bias. We've made progress with stigma and cancer, but it still does evoke feelings from people that can come across as negative. And there are dynamics that emerge among teams where peers may have questions or concerns about workload redistribution and all of those issues. So facilitating open communication, addressing team dynamics, those all become important for a manager as well.
That is very insightful. Thank you for sharing, Dr. Palmer. And another quick story. As I was preparing for this conversation, I had a conversation with my partner, and we did talk about what she went through. And almost word for word, she mentioned that it would have been nice if someone would have assumed that she needed help during that time. And that's something you said as well. And I have been on the other side, and I fully believe in that. What's also resonating with me is the problem-solving part of this. No cancer situation will be the same. People have different needs. They have different support systems. And being able to find the best and the right way to support is a very necessary skill. So thank you for sharing. I do have another question for you, Dr. Palmer. On the national level, are there any trends that you've observed that are shaping support for those facing the disease?
Sure, and that's a broad question. I think there are some trends and there are some important shifts happening. First, and I think it really is the theme of our conversation, is there's a shift to understand cancer as a chronic disease. We're having increased rates of long-term survivorship. There's growing recognition that cancer is not simply an acute illness, but often a chronic condition, can have recurrences, can have relapses, depends on the type of cancer. And I think even throughout this conversation, just the term cancer is so broad, but it's cancers. There's so many different types of cancer and how that impacts people. But for a number of them, there's increased long-term survivorship, and thinking of this in a chronic disease lens can be helpful. Second, we've improved our access to cancer care and recovery support, which is great. Telemedicine has changed things, legislative changes, paid sick and family medical leave expansions, which have been certainly present in many countries, have really helped with job protection and income security for people who need time off, and that has been an important set of changes. Third, we have really begun, and as a psychiatrist, I wish we were further on this, but I think we are beginning to meaningfully integrate mental health care into cancer care, that everyone who goes through cancer is going to have emotional challenges, that it should be part of the standard of care, and how we support people can be really important. So certainly at Health Partners, we have a partnership with a group called IRIS, which is part of OncoHealth, and these are specially trained clinicians that focus on mental health within a cancer care team. And it's a unique area to be able to provide services for. And then certainly peer supports and peer counseling becomes really important in the process of supporting people through cancer. Fourth, I think there has been incredible advance in cancer research and treatment. Even in my career in medicine, we have seen increased personalization, targeted therapies, the Moonshot Initiative, precision oncology, immunotherapies. These are all becoming increasingly sophisticated treatments and a reason for hope for people, and also can feel overwhelming to imagine what all is available and helping people get the care they need. And then finally, I think there's another trend around prevention. We've seen tobacco use decline markedly with associated decline in lung cancer. We've seen uptake of HPV vaccination, which really has changed the entire landscape for cervical and other cancers. And we're beginning to think more that cancer can and should be prevented.
Thank you, Dr. Palmer. And I want to ask you a follow-up question. We talked about the legislative changes, the cancer research improvements and changes, and also that telemedicine has brought a lot of changes to the support that is provided. But with the cost of cancer-related health care being steep and currently being projected to cost employers nearly $250 billion by 2030, where do you see EAPs and healthcare plans in this equation and helping organizations mitigate some of these costs?
Those costs are indeed staggering, and I think there are several important things that we can do to help. First, providing coverage and actually increasing utilization of screening is really important. Early detection is one of the most important ways to save lives, and it also helps control costs. For example, if we can treat stage 1 breast cancer, that costs about $191,000 less every year than treating stage 4. We really want to encourage people to get mammograms, to get colonoscopies, to be able to have appropriate cancer screening that's recommended, and employers can be very helpful with that. In terms of what an EAP can do, I think there are so many good uses of EAP here. This is one of those times. Imagine, for example, there's about 70 days that occur in waiting between an abnormal screening and the initiation of cancer treatment. EAP can support a member during that time emotionally, but also help them advocate for themselves with obtaining needed care, et cetera, to reduce that time, which has cost benefits and also emotional benefits for people. And then third, I think the EAP has a huge role to play in support for managers. We've talked during this podcast that what we're asking managers to do is to wear several hats simultaneously and have levels of nuance and sophistication that in an area where they probably don't have the medical background and they do have the managerial skills, but they're being asked to use them in different and more flexible ways. EAP could be a terrific support for managers going through, with employees who are going through a cancer treatment.
Thank you so much for sharing your insights. Dr. Palmer, it has been an absolute pleasure having you in this discussion.
So glad I could join you today, Andre. I really enjoyed talking with you.
Thank you. As a final note, I do want to remind our listeners, Workplace Options recently introduced the Return to Work Cancer Care Compass program, which provides support for employees recovering from cancer as well as for managers who guide them through the transition back to work. For more information about the Return to Work Cancer Care Compass program, as well as other mental health and well-being services for employees at your organization, visit our website, workplaceoptions.com, or contact us for more information. Contact details will also be posted to the podcast page. Until next time, stay safe and be well.